Hi guys, I am Dr.Aritra. So finally the NEET PG exam date has been announced. It is 15 June 2025 and still there are 6 months left, and it's a high time to gear up your preparation, to buckle up your preparation guys. So don't waste any time. Let's dive into your preparation. Okay, today I am starting with the NEET PG revision series, NEET PG or NICT revision series. Today's topic or subject is anatomy. And in this video, I will be pinpointing the important topics that you need to master for anatomy. Okay, you can get all the questions correct in INICT or NEET if you are focusing on these topics only, because it is humanly not possible to complete all the topics of anatomy. It is not possible. It's a devastating subject, but you need to give your 100% to complete these topics. Okay, and these topics consist of your previous year topics also, previous year questions also, and also the special important topics that can be asked in the subsequent years. So without further wasting any time, let's get started with this topic. And one thing, if you have already done your first reading and you want to concise your main notes, then this video is for you. And also, if you have not done yet with your first reading but still want to complete anatomy within few days, then this video is also for you. The first chapter is head and neck. Read about the foramen of skull in detail. Cranial nerve, third, fourth, sixth, their clinical aspect. Fifth cranial nerve, ophthalmic, maxillary, mandibular division, their sensory, motor nerve supply. Seventh cranial nerve, facial nerve, its course and clinical aspect. What are the different level of facial nerve injury? Read it carefully. Then read about the ansa cervicalis and what are the muscles supplied by ansa cervicalis. Cranial nerve origins as seen in gross anatomy. This is very much important for INICT. Then auditory and visual pathway. Then read about the different parasympathetic ganglia, the ciliary, pterygopalatine, submandibular and otic ganglia. What are the topographical nerve and what are the functional nerve. Then read about the muscles of palate, pharynx, larynx, tongue and infrahiatal muscle. What are the nerve supply of these muscles and what are the exceptions of that. Then dural venous sinus, the most importantly the cavernous sinus and its relation. Then in face, you have to read the sensory nerve supply of face and the venous drainage of face. And nerve supply and arterial supply of dura. This is very important for INICT. Then comes to the deep cervical fossa, the carotid sheath, then triangles of neck, its boundary, the floor of the posterior triangle, and the content of occipital and subclavian triangle. Then there are some important topics of the head and neck that are overlaps with other subjects also, like surgery, ENT, eye, like that. Like thyroid, its arterial supply, venous drainage, nasal septum, its structure of the nasal septum, little area, lateral wall of the nose, meatus, and the different structures draining into the different meatus of the nose, and the structures passing in between the gaps of the pharyngeal constrictor muscle at different level. This was a very important question and it was asked 2 times in INICT. The nerve supply of the pinna, very very important topic. Medial wall of the middle ear. After that, there are some artery of head and neck and its branches are very important, like subclavian artery and its branches. What are the branches that are originating from the first, second, third valve of the subclavian artery? External carotid artery and its branches of the maxillary artery and its first, second, third valve. It is very tedious job to remember all these branches, but you have to do that. It is important. Then branches of the facial nerve, facial artery in neck and face. Then comes to the pterion. What are the structures situated behind the pterion? What is the artery? It is important for INICT. It is asked multiple times. The nerves related to the pterygomandibular raphe, inferior alveolar nerve and lingual nerve. Then temporomandibular joint, its movements. What are the protrusion, retrusion, side by side movement? Okay, and what are the muscle responsible for this movement also? You have to read it carefully. Then tongue, its movement. What are the safety muscle of the tongue? What are the 12 cranial nerve injury? What happens to the 12 cranial nerve injury? And what are the papilla of the tongue? Especially filiform papillae and circumvallate papillae. This was very important and it was asked in this year NEET also. Then hypoglossal muscle, hypoglossus muscle, its structures lying on the hypoglossal muscle and the structures lying behind the hypoglossus muscle. Infratemporal fossa and nerve supply of the parotid gland, very important topic. Then comes to the pharyngeal arches and their derivatives. It's a very very important topic. You have to read thoroughly the pharyngeal arches, pharyngeal pouches and their derivatives. Development of tongue and face, and lastly the cleft lip, and the cleft lip is due to non-fusion of, you need to know that. Okay, In neuroanatomy, firstly, you need to know the functional columns of the cranial nerve. This is very important topics. And what are the arrangement of this functional column from medial to lateral? This was asked in INICET. Okay, then read about the spinal cord. The spinal cord ends at what level in adult and in a pediatric population? Pia mater, arachnoid mater, dural sac, phylum terminal, internal, final terminal, external. Ends at what level? You need to know that. Then the tracts like dorsal column, spinothalamic tract, spinocerebellar tract, and pyramidal tract. You need to read it. Okay, you can read it also from physiology also, because in physiology these are more clinically relevant. Read about the Brown Sequard syndrome and syringomyelia. Then blood supply of the brain, circle of Willis, the branches of the vertebral artery, branches of basilar artery, and branches of the internal carotid artery. Then arterial supply of the different surfaces of cerebral hemisphere. This arterial supply is a very hot topic for NEET PG as well as INICET. The anterior cerebral artery present in callosal sulcus, middle cerebral artery present in lateral sulcus, blood supply of the motor and sensory area, ACA plus MCA, blood supply of the occipital or the visual area, PCA plus MCA. MCA supplies the macular area, the speech area supplied by the MCA solely, the blood supply of the internal capsule, the fornix is supplied by ACA, and the blood supply of the corpus callosum. You need to read it as a whole. Okay. Then comes to the venous drainage of the brain. What are the superficial veins and what are the deep veins? What are the vein of Trollard? What are the vein of Lave? You know that the superficial middle cerebral vein, it connected to the superior sagittal sinus and the transverse sinus by vein of Trollard and vein of Lave. You need to read it carefully. Okay. Then deep veins. What are the internal cerebral vein, great cerebral vein of Galen, and the straight sinus, the thalamostriate vein, the cortical vein, and the septal vein. They joins to form the internal cerebral vein. The internal cerebral vein drains into the great vein of Galen, and then it also drains into the straight sinus. You need to read it. Okay. Then comes to the brainstem syndromes. You will read it clinically, okay, in detail in medicine. So try to read this brainstem syndrome from medicine also. Okay. Then comes to the cerebellum. What are the parts of cerebellum? What are the deep cerebellar nuclei? What are the afferent? What are the efferent of cerebellum? And also read the molecular structure, the molecular layer, Purkinje layer, and the granular layer of cerebellum. Cerebellum is important topic. Thalamus. What are the nuclei of thalamus and the mammillothalamic tract? It connects with the anterior thalamic nuclei. Remember it. Then the hypothalamic nuclei and their functions. You will read it. In great detail in physiology. So try to read it from physiology also. Now ventricles of the brain. What are the ventricles of what are the boundaries of third ventricle? Then floor of the fourth ventricle. The lateral ventricle. What are the parts of the lateral ventricle? The anterior horn and the body. The relation of the anterior horn and the body of lateral ventricle. Then comes to the complete sulcus. The calcarine sulcus and collateral sulcus. The calcarine sulcus is the elevation in the posterior horn of the lateral ventricle. That is known as the calcar avis. And the collateral sulcus is the elevation in the inferior horn of the lateral ventricle. That is known as the collateral eminence. Okay. Then read about the circumventricular organs, also known as the areas that are devoid of blood-brain barrier. Then read about the association fiber, commissural fiber, and the projection fiber. Their examples are important. What are the parts of the corpus callosum? Then fornix. It is made up of which type of fibers? The best answer is association, commissural plus projection fibers. But if it is not there, the second best option is association plus commissural fibers. These are some important, some minute dilemma that can happen during solving your question. So I am also clearing that. Then read about the types of sulci, the limited, operculated, axial, and the complete sulcus. Then read about the functional areas of cerebrum, very much important. Then internal capsule, it parts and blood supply. What is Charcot artery? The arrangement of the fibers in internal capsule, the retrolentiform fiber that keeps to the optic radiation, and sublentiform fibers that reaches the auditory radiation. Then read about the Papez circuit in detail and the cerebellar peduncle. Lastly, the cerebellar peduncle. It is important for INICET, the superior, middle, and the inferior cerebellar peduncle, and what are the afferent and efferent fibers of this peduncle. Okay, this is solely important for INICET. In thorax, firstly you need to know the internal intercostal artery, intercostal vein, and intercostal nerve. You read it in detail. Intercostal artery, what are the anterior intercostal and posterior intercostal artery? Intercostal vein, anterior and posterior intercostal vein. Azygous venous system, read it thoroughly. Obstruction to the SVC. What happens to obstruction to the SVC? above the opening of the azygous vein and below the opening of the azygous vein. This was once asked in NEET also. Then intercostal nerve, what are the typical and the atypical intercostal nerve? Then read about the thoracic duct, where does it originate, where does it drain? Okay, read it. Then phrenic nerve, what is the relation of the phrenic nerve? It is also important. Then comes to the diaphragm, what are the major and minor openings of the diaphragm? What are the levels of these openings, and what are the structures that passes through these openings? Origin and insertion of the diaphragm, development of diaphragm, and Bogdalek and Morgantian hernia. These are important. Then comes to the mediastinum. What is the plane that divides superior and that demarcates the superior and inferior mediastinum? Then read about the contents of anterior, medial, posterior mediastinum, and superior mediastinum. Read about the contents. Okay. Then comes to the pleura. What are the parts of pleura? Extent of pleura in mid-clavicular, mid-axial and mid-scapular line. What is Simpson's fossa? Root of the lung. What is the arrangement of structures superior to inferior and anterior to posterior at the root of the lung? Nerve in front of the hilum is phrenic nerve. Nerve behind the hilum is the vagus nerve. The bronchopulmonary segment. What are the characteristics of the bronchopulmonary segment? How many bronchopulmonary segments are there? How are they numbered? You need to read it. Then constriction of the esophagus and arterial supply of esophagus. Pericardium, what is transverse and oblique sinus, and heart. It is also important topic. What are the surface and borders of the heart? Anterior interventricular groove forms the anterior interventricular groove is located in the sternocostal surface. Posterior interventricular groove located in the diaphragmatic surface, and posterior atrioventricular groove is present between the diaphragm and the base. The left atrium is in front of the esophagus. Right ventricle is in front of the sternum. Then arterial supply of the heart. What is aortic sinus? What is non-coronary sinus? And what is and read in detail the right and left coronary artery and their branches. Venous drainage of the heart, coronary sinuses and veins not draining into the coronary sinus. Then development of CVS is very important topic. Formation of atrial septum, formation of the interventricular system, the internal anatomy of the right atrium, the patent truncus arteriosus, transposition of vessel, and tetralogy of Fallot. Then aortic arch arteries and their derivatives, very very important topic. Development of superior and inferior vena cava, fate of sinus venosa, fate of vitelline vein and umbilical vein, and first rib. First rib, what is the anterior relation of the neck of the first rib? What are the structures present in the neck of the first rib? Chapter upper limb. In upper limb, firstly you read the axillary artery and its branches. The brachial plexus, os palsi, Klumpke's palsy. Clavipectoral fossa, it encloses two muscles, and the clavipectoral fossa is pierced by which structures? Read it. Origin, insertion and nerve supply. Origin, insertion, nerve supply and action of the following muscles. Pectoralis major, serratus anterior, deltoid, rotator cuff muscles, biceps, triceps. Okay. And the intertubercular sulcus, the muscle attached to the lateral lip, medial lip, and the floor of the intertubercular sulcus, and the structures passing through the intertubercular sulcus. Read it. Greater and lesser tubercle, supra-infraglenoid tubercle, coracoid process. What are the muscle attached to these structures? Read it. Then upper, lower triangular space and quadrangular spaces of arm, and what are the structures passing through these spaces? Muscles of front of forearm, the brachialis, biceps and coracobrachialis, the muscles of the front of forearm, 5 superficial, 3 deep muscle, and their nerve supply. Read it. Cubital fossa, what are the arrangement of structures in cubital fossa from medial to lateral? Carpal tunnel, what are the structures passing the superficial and deep to the flexor retrogulum? You need it carefully. Then anatomical slump box, what is the boundary, floor, and content of anatomical slump box? Back of the forearm, what are the superficial and the deep muscle? Extensor, which muscles are the extensor of the thumb, which are the extensor of the wrist, and which are the extensor of the digit except thumb? Read it. And nerve supply of these muscles. Then comes to the palm. In palm, read the thenar and hypothenar muscles, lumbricals, interossi, and their function and nerve supply. Superficial and deep palmarage is the continuation of which arteries? Read it. Then radial, median, and the ulnar nerve. Their course, their branches differ in level of nerve injury, their clinical aspect, test of different nerve injury. You read it very carefully because these are also important in orthopedics also. You will read it in orthopedics also. These are clinically very relevant. In each year, 1 to 2 questions come from these topics. Then sensory supply on the palmar and the dorsal aspect of palm. Scapular anastomosis at the dorsal aspect of the scapula. Then from the osteology point of view, read about the clavicle, level of the superior angle of the scapula at T2, level of the spine of scapula at T3, inferior angle of the scapula at T7, coracoid process palpable in the infraclavicular fossa, the long head of the biceps, The long end of the biceps is intracapsular but extrasynovial. Long end of the triceps is extracapsular but intrasynovial. Then triangle of auscultation and a shoulder joint, its movements. What are the muscles responsible for the different movement of shoulder joint? Read it. Chapter Abdomen and Pelvis. Firstly, read about the structures at L1 level. Transpyloric plane, L3 level, subcostal plane, L4 level, it is the highest point of the iliac crest, L5 is the transtubercular plane. Then inguinal canal, the roof, floor, anterior wall, posterior wall of the inguinal canal, the content of the spermatic cord, what are the coverings of testis and direct indirect inguinal hernia, Hasselbeck triangle, very very important topic. Abdominal aorta, its branches, celiac trunk, superior mesenteric artery, inferior mesenteric artery and their branches, the arc of Riolan, marginal artery of Drummond, Sudex point, Griffith point. Then tributaries of IVC, blood supply of the suprarenal gland, superior, middle and inferior suprarenal gland, posterior relation of the kidney, anterior relation of the kidney, the layers to be reflected to reach the kidney, thoracolumbar fossa. These are all important topics. Then stomach bed structures, epiploic foramen, its boundary, the root of mesentery, structures caused by the root of mesentery, duodenum, what are the four parts of duodenum, their relation, jejunum, ileum, comparative study. Appendix, the base of the appendix located at McBurney's point, what are the anatomical variation of the appendix. Then liver, coinor segment, very much important, you will read it in surgery also. What is Calor's triangle, caudate and quadrate lobe relation. Then gallbladder and the bile duct, their parts, relation, sphincter of Oddi complex. Portal vein formation, their sites of portocaval anastomosis and parts of portal vein. These are important. In spleen, what are the dimension of spleen, extent of spleen, what is the long axis of the spleen, the notch of the spleen is located at the superior border, it makes 45-degree angle with the horizontal, and what are the ligaments of spleen, gastrosplenic ligament, leorenal ligament, what are the important artery located in this ligament, and which ligament, the phrenicocholic ligament that prevents the downward displacement of spleen. Okay, this is important. Then pancreas, what is the different parts and their relation, internal iliac artery, its branches, anterior and posterior division. In ureter, read about the blood supply of the ureter, the length of the ureter 25 centimeter, anterior relation of the ureter, and what are the constriction of the ureter. Then prostatic urethra, very much important. Rectum and anal canal, what are the length of rectum and anal canal, what are Houston's valve, what is pectinal line, what is the white line of Hilton, what is the importance or significance of pectinal line, what is the difference between the above and below pectinal line, what is the difference. Then read about the perineum, what is superficial and deep perineal pouch, what are the contents of superficial and deep perineal pouch, urethral injury and bladder injury, different level of injury. In bladder, extraperitoneal, intraperitoneal injury, and in urethra, proximal urethral injury or distal urethral injury. What are the different clinical aspects, how you clinically differentiate them, read it. Then ischiorectal fossa boundary, it is important. Then from the development point of view of abdomen and pelvis, read about the derivatives of dorsal and ventral mesogastrium, very very important topic for NEET. Then midgut rotation and its abnormalities, omphalocele, gastrocysis, anorectal canal and urogenital sinus development. From anorectal canal, rectum, anal canal develops, from the urogenital sinus, urinary system develops. So read about the development of the urinary system as well. What are the derivatives of mesonephric and paramesonephric duct and their remnant in male and female. What is the derivatives of genital ridge, genital swelling, genital fold, and genital tubercle in male and female. And development of pancreas also, the annular pancreas, okay, and the pancreatic division, these are important. Then read about the splenic nerve and what is nervi eruginitis. So these are all important with respect to abdomen and pelvis. Chapter lower limb. In lower limb, first read the lumbar plexus. What are the nerves originating from the lumbar plexus? What is the nerve that is situated in the iliopsoas group, nerve situated over the psoas major muscle. So read it. Then inguinal ligament, its attachment, 3 extensions of the inguinal ligament. Then femoral triangle, boundary, floor, content of femoral triangle, femoral canal, femoral link, femoral sheath, everything important. Femoral artery and its branches, arterial supply to the head and neck of the femur, very very important topic. Adductor canal, action of the hip joint and muscles responsible for different action or movement of hip joint. Flexion, extension, adduction, medial rotation, abduction. Okay, sartorius gracilis, their action on hip joint and knee joint. Gluteal region. In gluteal region, read about the gluteus maximus, medius minimus, their nerve supply, action of hip and their attachment. Also read the Trendelenburg side. This is clinically very important. Hamstring muscle, what are the true hamstring, what are the modified hamstring, what are the structures forming the sciatic bed and the structures passing through the geta-sciatic foramen above and below the piriformis. Read about the popliteal fossa, its boundary and content. In knee joint, locking and unlocking of the knee. What are the structures responsible for locking and unlocking? What is the anterior and posterior structure in cross-sectional image, anterior to posterior structures? Read about the ligament of knee, menisci, anterior cruciate versus posterior cruciate ligament. Need to do comparative study, and collaterals, medial and lateral collateral ligament. In leg, the anterior and the extensor compartment, posterior the flexor compartment, lateral or the peroneal compartment. What are the muscles? What are the actions, arterial supply and nerve supply of these three component? Read distinctly in a comparative manner. Then cutaneous nerve supply of the plantar and the dorsal aspect of the sole. What are the muscles supplied by the medial and the lateral plantar nerve? These two questions are multiple times repeated in NEET as well as INICET. Then arches of the foot, medial and lateral longitudinal arch. What are the deltoid ligament, lateral ligament, Lisfranc and the Chopard ligament? Read it. Then the course of the great saphenous vein and the short saphenous vein. Now topics: histology. Read about the glands: holocrine, apocrine, merocrine gland. Their example: apocrine and ecrine sweat gland. How to differentiate between them. Then read about the parotid, submandibular, sublingual gland. Histology. Then types of cartilages: hyaline cartilage, elastic cartilage, fibrocartilage. Need to read the examples and you have to identify in histological image. Now histology of the pancreas, lymph node, spleen, thymus, tonsil, glomerulus, lungs and liver. You just need to identify those images. Okay, there are one important key features that you need to identify in those images. Just read that, not to read in detail. Don't try to read in detail. Then gastric gland, identify the parietal cell, chief cell, stem cell, and remember the stem cell of the gastric gland is located at the isthmus. Then ureter and the vas deferens, you have to differentiate it in histological picture, because the lumen of both these structures looks like a star shape. Okay, then epithelium, transitional epithelium, pseudostratified epithelium, stratified squamous and simple cuboidal epithelium. They are example. Now in histologically you have to differentiate cerebrum versus cerebellum, important. Then examples of the regular and dense irregular connective tissue. These are all you need to read from histology aspect. Okay, then comes to the general anatomy. In general anatomy, read the synovial joint. What are the examples of hinge, condylar, ellipsoid, saddle, pivot, and ball and socket type of synovial joint? Then read about the primary versus secondary cartilaginous joint with example: primary cartilaginous joint, also known as synchondrosis, and secondary cartilaginous joint, also known as the symphysis. You need to know their differences and their examples. Then the fibrous joint, syndesmosis, kyphosis, and syndialysis. Then general embryology. You read just the derivatives of the paraxial, intermediate, and lateral plate mesoderm, the derivatives of the neural crest cell, the events in second and third week of fertilization, then primitive streak, sacrococcygeal teratoma, how the neural tube formation occurs, the closure of the anterior and posterior neuropore, 25th and 28th day of intrauterine life, and then read about the allantois that forms the urecus. So this is all that you need to read from general embryology. Finally, one thing I want to tell you that whenever you are reading anatomy, try to keep the Netter's atlas besides you. Try to see those pictures that are frequently asked in your exam, because that will create a visual memory and it will help you to identify those structures that are asked, like identify this nerve, identify this artery, so on and so forth. Okay, and this way I have tried to compile all the important topics of anatomy, all the previous year topics, and potential questions that can be asked in your subsequent exam. So you just need to focus on these topics only, get a good hold on these topics, and have faith on your source. Don't change your source. Don't try to gather all the information from here and there. Okay, have faith on yourself. Keep revising these topics. Sort out those unnecessary topics. You don't need to read anything more than that. Okay, these are more than enough, more than your revision notes. Read this multiple times, and you will not fear anatomy again, I promise you. Okay, so keep reading, guys. I will be coming up with the next video soon. So until then, tata guys.